Cardio 1. The patient is a 59-year-old man who presented to the emergency department via ambulance with substernal chest pain of 2 hours duration. He has a history of hypertension, hypercholesteremia, adult onset diabetes, and 1 pack per day cigarette use. The pain began at rest while watching television and is described at 9 out of 10 in intensity. It is accompanied by dyspnea and diaphoresis. The patient denies palpitations, dizziness, or syncope but feels weak. It has not been relieved by sublingual or intravenous nitroglycerin, and ECG in the ambulance shows ST and T wave elevations in precordial leads. He denies any prior angina type episodes. There is no family history of heart disease. Cardio 2. The patient is a 90-year-old woman who presents with severe dyspnea at rest. She has a history of 2 prior myocardial infarctions and an ischemic cardiomyopathy since at least 10 years ago. She has been admitted twice in the past 5 months for congestive heart failure exacerbations. She describes having progressively swollen ankles for the past week, accompanied by orthopnea over the past 2 days. She states that she is taking her medications and denies any dietary indiscretion, including salt. In triage, her oxygen saturation by finger pulse oximetry was found to be 89%, and she was placed on 2 liter per minute oxygen by nasal cannula, with her oxygen saturation subsequently rising to 94%. Trauma 1. On admission to an emergency room, this 24-year-old male was noted to be in shock with a BP of 60/40. History revealed that he had received a 12-gauge shotgun blast from the close range at 10 feet. The entrance wound was the left hip. There were multiple stab wounds noted about the chest and the abdomen. On initial examination, none of the stab wounds appeared to penetrate either the chest cavity or the peritoneum. The lungs were clear. The detailed physical examination of the hip area revealed that the femoral artery was severed and was the source of hemorrhage that is producing the shock. It was noted also before patient lost consciousness and could still speak that the left foot and ankle was without movement and blood flow. Emergency resuscitation was begun. The groin wound was packed. Patients were transfused and taken immediately to the surgical suite. Outpatient 1.